Good morning. Today we're going to be talking about colorectal cancer because there are a lot of exciting new developments in the field. Thank you, Dr. Austin Obicere, for coming on the program once more. It's always a pleasure to have you with us.
Thank you for having me.
Now, you are an expert in the field, a colorectal surgeon. Can you just briefly define for us what is colorectal cancer?
I think in layman's term is if you can imagine a cell, every particular cell we have in our body has a programmed date of death. So that's why we are born and we ultimately die at some point. So the cells, every cell dies. That's the normal pathway. Now, some cells lose that key to turn them off, and they basically they grow and they grow. There is no end stage death. Now, unfortunately, in colorectal cancer, the lining of the bowel, some of these cells take this path where they grow and they grow to the point where they can then spread beyond their sites of origin. And this ultimately is a cancerous cell. Involving the colon and rectum, it's described as colorectal cancer. So in simple terms, these are cells that do not die. They literally continue to grow. And as they grow, they consume all the energy and reserves or all surroundings, which ultimately suffer because they are almost, invincible. So that in simple terms is a cancerous cell.
And specifically in the colorectal area, what are the kinds of signs and symptoms a person with colorectal cancer would have?
Right. Well, the symptoms are variable. I think we have zoomed as those with interest in the area is what are those simple things that people can look out for? First and foremost, the commonest is bleeding, is a rectal bleeding. Now, having said that, I have to be quite careful and explain that there are many, many other benign causes of rectal bleeding. Typically, everybody's got hemorrhoids or piles and all sorts of things. Now, some people try and describe, well, is it the characteristic of the bleeding that may raise questions that you have colon cancer? And the answer is absolutely no, correlation between. However, blood remains the commonest medical attention if it doesn't go away within a week or two. The next thing is that generally people talk about change in their bowel pattern. So if you're one of those that you go to the bathroom like clockwork at a particular time of the day, or you're usually being soft, you're now being constipated or vice versa, I think the simple answer away from the norm, and that change lasting for or two. And then those that actually have got it, I try to do, a cell that literally lives forever and will consume its surrounding structures. When it occurs, it actually would lead to a loss of weight. So that seems to be a very common symptom for a lot of patients, and they tend to have actually advanced disease in that they lose weight despite good appetite. They may, again, from the bowel point of view, when we talked about a change in bowel habit, another common symptom is what we describe as tenesmus. In other words, one goes to the bathroom, they think they have emptied, and they leave the bathroom, they feel they have to go back because there's this constant feeling of not emptying. Now, because of the loss of blood over a prolonged period can cause anemia. Anemia, as you know, is a low blood count, and it presents itself in terms of easy fatigability, easy tiredness, just walking up the stairs, you feel so tired and you're weak. So that is something we can easily detect just from doing simple blood tests. So I would say essentially, if you put these together, the rectal bleeding, change in bowel habit, feeling of tenesmus, weight loss, anemia, these are the characteristics that raise concern. And finally, for those who are unfortunate, have quite advanced disease, they may be able to actually feel a lump in their tummy. And that is an abdominal mass. Again, that's usually not a good sign. So one would hope we avoid getting to that stage.
Yes, one of our focuses here is it's actually on prevention. That's actually why the program was actually set up to focus on prevention. And at first, let me ask, how common is colorectal cancer in Nigeria? The reason I'm saying this is that I remember as a medical student, I don't even recall seeing a case. And I was a diligent medical school student. I wasn't one of those who didn't go to class. I was very diligent and I don't recall it. And it seems to be now almost like an explosion.
That's a fabulous question that I think I've tried to answer for the last 10, 15 years from my contact with Nigeria. Now, the simple answer is that it's always been there, Pamela. And yes, I will attest to your viewers that yes, Pamela was indeed a diligent student. As I was a year ahead of her, she was one of the efficos, as we would use the term. But anyway, in the last decade in Nigeria, there's been an practices in terms of now you can directly visualize the tumor using an endoscope, whereby previously we all relied on the barium enema, which, as you know, the sensitivity, specificity is actually really very low. You're more likely to diagnose a cancer in those stages when they are advanced, because that's when the tumor is grown and you can see a big lump on your, or a defect in your barium enema. But I think with the introduction of endoscopic techniques, particularly endocolonoscopy, that has led to a complete revolution in the diagnosis of colon cancer. Furthermore, I guess people are a bit more aware because they hear these stories and now they obviously want to seek how to prevent the disease. And just to, as you mentioned, I think the most I must get across to your, audience that honestly, the most important thing about colon cancer, God forbid, if you want to have it, you want early stage disease. And I know we're going to talk about these fascinating new drugs that are coming out and they're saying they're curing you. You want to avoid that stage. You want a stage where you want a situation where you have symptoms, you get yourself checked out, they do and diagnose cancer and it's early stage 1 or 2, because that stage 1 or 2 cancer is confined to the bowel and it is easily curable by surgery. And that's the end of the story. When we move on to chemotherapy and advanced disease like liver resections is because the tumor has spread beyond the bowel. So the objective is to catch it early, and you can catch it early by getting yourself screened and being aware of these symptoms we've talked about.
Now we're talking about screening, but we also need to recognize that in our own environment, a lot of people don't want to do it. And this is a fact. A lot of people who listen to this program do actually. And so we're going to talk about how to screen, when to screen, and how frequently to screen. I think that needs to be talked about. But we also need to address the fact that people say, you know what, Hmm, you know, I don't want to go and look for trouble. I don't, they have this whole, uh, trouble they sleep here and I go wake up. All sorts of, funny statements say, I'm screaming because I can't, but they can.
It certainly can. And I think it's a combination of people are obviously afraid. And I think the truth is programs like this, this is the way you can save your life. Actually screening saves lives. So when should we screen? Well, as you know, here in the United Kingdom and Europe, generally, the peak age incidence of colon cancer is 67 years of age. So it's usually most people, who are much elder citizens, although it can obviously occur in younger people if they carry bad genes. Ironically, if you extrapolate that to Nigeria, the data we have, which albeit limited, says the peak age incidence in Nigeria is 44 years old. So
Mm.
how do you explain that? And we started the conversation earlier on how you recall we never saw colon cancer cases in medical school. And yet suddenly now we are seeing cancers not just 20 years lower than the peak incidence you have in Europe. So there's clearly something going on. We don't know, and I think the person who identifies the reason would almost certainly win the Nobel Prize. Now, coming back to when should we screen, whereby here in Europe people start screening programs from 50 years onwards. In Nigeria, I almost without doubt would recommend that whether you're male or female, you are 40 and above, you should consider yourself, you should screen yourself. Now, obviously, if you are younger and you have symptoms, please do not ignore it. If those symptoms persist for more than 6 weeks, I think you should seek medical attention.
Yeah, now we're talking about young, in particular young men. You say in Nigeria, but I recall the Wakanda Star. He was a young man. He was American. Or is it just black people that it's exploding in, as opposed to, you know, the Caucasian race? Is that something to do with being black?
Well, actually, to be honest with you, I think it's got nothing to do with color, although the data also shows that the incidence of colon cancer in the American population is actually higher in the Black population. And worse still, they present with more advanced disease. So nobody can explain this. Yes, he was 39, I think 38, 39 when he was diagnosed, and he died pretty much 3 years later. We really do not understand. Is there something in the Black genome that actually encourages progression of disease? One could also argue that, we as Black people are one of those, find it very difficult to actually accept symptoms, and particularly men, be you Black or white or any other race. Men are unlike women who are far savvier in terms of health screening. I think they've grown up understanding screening, but for men, I think it's still a new thing, and it's not seen as macho that, oh, I've got a bit of rectal bleeding, I want to go and check out, what it really is, or I have an appointment with my doctor. So it's something I think with time, as we continue to just stress the importance of, regardless of who you are, your background, that you get to a specific age, particularly in Nigeria, 40 and above, you should take your health seriously and embark on regular screening exercises, not just for your colon cancer, be it your prostate, and as women already have established screening for breast and cervical cancer and so on and so forth. This should be a routine.
I think it's important that people note that. And I must say, unfortunately, also in Nigeria, established screening for, breast, even for cervical cancer, a lot of women are still not doing what needs to be done. And so I think it's just important, as you're emphasizing now, the fact that right now, cancer is curable. And this is magic to even be able to say those words. Cancer is curable, and people just need to seek help early. Thank you very much. Thank you, sir, for coming on the program and sharing your experience with us. Can you tell us how you found out you had colorectal cancer?
Thank you, doctor. Well, for me, it's been a journey, and maybe I'll start that journey with the fact that for a few years, or for about a year, I had known that I had hemorrhoids, what people would traditionally call pile, okay? And it will reduce on its own. It will go back on its own. So I knew that was there, but I felt no pain. There was no bleeding. So that was that. Then I noticed that there were some changes. Normally, my bowel movements, my bowel habit was usually once a day, in the mornings, maybe once in a month or in 2 weeks, be twice a day. Then I suddenly noticed that my bowel movements became like 3 or 4 times. I would then I will feel like Obicere was saying earlier in the needed to go back. I did not finish. So that was the first thing that I really noticed. And then the next thing that I noticed was when I want to clean up, I then discovered that there is some frank blood on my tissue paper. And then a few weeks later, I then noticed some blood streaks in the WC after I finish. Then in my mind, I just felt, okay, some of my friends have said hemorrhoids come with bleeding. So I felt, okay, maybe it's hemorrhoids, no real pain in my tummy. There was no losing of weight, which I had later from my doctor that could happen. Then I went to see my family doctor. And that was when I was then asked to, an examination was done, a rectal examination was done, and then I was asked to do the colonoscopy. I went for the colonoscopy. Really, it's a painless test where the doctor will then put a probe through the anus, the rectum, and they will be able to see the system. I was able to visualize it. That calmed me down. I did not, even though there was no pain, it was painless. Later, the doctor told me, they gave me some little sedation, but I was watching, and they were asking me also to watch it as it was going on. After the procedure, I was then told they picked a few things. They call them polyps, and then it was sent. It was sent for this biopsy was then sent to the lab. So that was the journey at the beginning. But while that was happening, my doctor was also saying on the other side, I should then go for a chest X-ray because the polyps or whatever they picked was pointing at something. Okay. And I then started doing an X-ray, wanted to see my chest. Is there anything there? They wanted to see my liver. I was also asked to do a CT scan with contrast, abdominal and pelvic. So they wanted to look at my liver and my abdomen. And so those were, and then they did some blood tests. They talked about liver enzymes. They talked about tumor markers, and they just wanted to see that. So that was already going on. So my GP then linked me with Dr. Obicere, that is also on the call today. And I think it was a good journey from then on, because there are a lot of worries when you hear and you start hearing the stories about cancer. So my mind was put at rest. The results of the biopsy came out from the pathologist, and I was told that this looks like a stage 2 colorectal cancer around, I know quite a lot of the names now, around the rectosigmoid junction. So Dr. Obicere and his team were talking to me. They were reviewing all the scans of the chest, of the abdomen, of the CT scan, and the contrast that was done. And I was then told that since it's a stage 2, it seems to have been caught a little bit early. Surgery may be a cure, but they could not give me a definitive. I may then need a chemotherapy. So that was the journey to knowing. But on that journey to knowing, doctor, I think one of the things I should also say was that there were a lot of emotional issues around that period too. So one of the things that I was able that my doctor also discussed with me is important to also talk to family that will encourage, or friends that will encourage, and not those that will be fearful, because fear itself may even depress your immunity. So one also needed the awareness, read about it, understand, and not be fearful. Because if you are fearful, you may not even go for the further management, and that may be an issue. So that was the beginning of the journey, doctor.
Yeah. So were you able to find that support in your family?
Yes, and I think that really helped. After discussing with Dr. Obicere and the team, I think that support came from my spouse, my children. I have elderly ones, I had young ones, but the thing was, we had to discuss it freely so that they understood what daddy was going through, the support that was needed. It was also not information for everybody. You know, when you tell this person and this, in our traditional African setting. So you also did not need that, because people, yes. And then for me, I'm also the spiritual part. And one of the things my doctor, fortunately, Dr. Obicere is also a Christian. So the spiritual part was also very important. So as you are doing the medical, you're also praying, you're also touching base with your connection that is Christ, and for those that are Islam or the other religions, you also have your connection. So that is also critical, because ultimately, my doctor always told me the healing comes from God, from the Lord.
Yes.
So,
Yes.
but he will do his part with the knowledge that he had, but that healing comes from God. So that was it. The family, the spiritual connection, and the medical components were the tripod for me.
Fantastic. So you had the treatment, you had the surgery. Did you need chemotherapy after that? And how many years ago was that? Can I just also ask, how old were you then and how old are you now?
Okay, so it's been a journey of a year. I was 49 when this happened. After the journey, I had my surgery. Dr. Obicere performed a laparoscopic surgery, and I used to think that surgeries you need to make a big scar, and but if you even look at my belly today, you will practically not see any scar there. So it was a laparoscopic surgery, and this is 1 year after. I'm 50 now, and I'm hale and hearty. I'm fine.
Thank
I've
God
been
for that.
what we do also is on like a quarterly basis, every 3 months, there are some tumor markers that are looked at, are checked. So the surgery cured it because it was picked up early. There was no need for chemotherapy and there was no need for radiotherapy. However, my doctor has told me every year, so this year I'm doing a colonoscopy again, and then maybe in the next 2 years I will have to do one, and so on. But I came out with a complete cure.
Fantastic. Dr. Obicere, unfortunately, we don't have much time. That was a phenomenal sharing by our guests. Thank you so much for sharing your experience. But Dr. Obicere, we only have a couple of minutes left to the program. And I just want to get your input on this. So would you say this is a typical way that an early cancer pickup just is dealt with? And so we have somebody else. He just sounds so positive. I'm just so excited, and so happy for him, Is this how it normally turns out if it's picked up
Absolutely.
early?
Well, I'm grateful that your guest came on this program, and that's exactly what we're saying. He had straightforward, having had all the screening tests that you had. He had staging tests to make sure the tumor hadn't spread anywhere else. That's the reason why he had the CT chest and abdomen. And once we confirm radiologically and clinically that the tumor is at one side, it's either a stage 1 or 2, it's curable. In fact, he had keyhole surgery. He was out of hospital on day 7. And, delighted for him. As no nodes are involved, he doesn't need chemo. He does not need any radiotherapy, just routine follow-up for the next 3 to 5 years. That's it.
Fantastic. So do you have any last words for our listeners?
Well, the last word for the listeners would be, please, I cannot overemphasize, the simple word is screening, screening, screening. Please, 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 the slightest, we've talked about these symptoms. If they happened, if you notice them, don't be embarrassed. Please don't leave it will disappear on its own. Go and seek medical attention. And I think the emphasis of this whole program is, if we diagnose you early, you are curable, full stop. Okay, we don't need to go about talking fancy chemotherapy agents or radiotherapy. The objective is to identify the disease at an early stage, see your clinician, you are surgically curable.
Thank you very much.
Thank you for your time.
Dr. Obicere, for those who are listening, people who are listening who want to reach you, how can they reach you?
Well, my NHS practice is University College London. I've been a consultant there now 20 years. And I do run a private practice, 81 Harley Street. But I'm sure we can provide details of how they can get in touch should anyone need any form of advice.
Do you have anywhere that you provide services in Nigeria for people in Nigeria at all?
Previously, yes, but I think the COVID has sort of made things very difficult. But yeah, I come to Nigeria once in a while, not as frequently as before. And, I guess they have to choose which clinical setting they would like to see me if I'm around. but I don't want to, I haven't got any set, time that I frequently visit Nigeria.
Is there a phone number that somebody could actually call and reach out to
Yes,
you?
I can share that with you and you can share it with your viewers. Absolutely.
Thank you. Thank you very much.
Thank you for having me.
Thank you for watching. Please like, share, and subscribe for new video updates.